Committee on Vaccination and Immunization, a panel of experts which advises the ministers, has been weighing the issues after numerous other countries have begun giving jabs to young teens. It has previously recommended giving approved COVID vaccines to all 16 to 17-year-olds, but only to the 12 to 15-year-olds who have underlying health conditions that make them more vulnerable to the virus. Well, to talk more about this, we're joined by someone who's on that panel, Dr. Rajay Narain, Director, Global Health Alliance, UK. Thank you so much, Dr. Narain, for joining us. Tell us about the reasoning, if you could explain that better to us, for why the experts are recommending not to give vaccines to those between 12 to 15 years of age. All right, we will just try and reconnect with Dr. Narain there, but this is a matter of concern given that India too is hoping to start vaccinations for those below 18 years. Yes, Dr. Narain, back with us. Do explain to us what the reasoning is here.
Yeah, thank you so much, Gagi, for having me on the show. You know, the JCVI, which is the Joint Committee on Vaccination and Immunization, came up with their findings last week, and this is based on lots of research around the world. We know that lots of European countries have started vaccinating children between 12 and 15. But in US, there have been a lot of reports about myocarditis, that is inflammation of the muscles of the heart in children between 12 and 16 especially. UK government and the UK experts have started vaccinating people, young children between 16 and 17. But when it came to between 12 and 15, there were reports about myocarditis and inflammation of the heart and some kids getting admitted post-vaccination, and hence the committee thought that it is possibly worth and where it is what they have to do a risk-benefit analysis and wait and watch to see what happens in the rest of the world, because we know when you get COVID at an early age between 12 and 15, the risk of hospitalization is less, the chance of you getting to the bad phase of COVID is less, and that is why the committee wants to wait and watch. It's not something to do with the supply of the vaccine, it is nothing to do with the stock of the vaccine, it is just to make sure that it is 100% safe to give the vaccine between 12 and 15.
So, Doctor, the government is yet to make its final decision. It's going to take all this advice into account, but that's quite concerning. So, you're saying that you weighed the risk to the children, and you feel that given these myocarditis cases are coming up which involve the heart, that it's better to hold off on vaccines for the healthy ones between 12 to 15 and only give it to those who have some sort of underlying conditions, comorbidities.
Yes, absolutely. We know, because we have to go by individual country data, and the data in the UK is that majority of the people who got admitted were above 18. Children between 12 and 15, there were hardly any admissions in the hospital. Children between 12 and 15 hardly had required anything apart from paracetamol to get out of this virus, just like a normal flu. So again, you have to think about the small number of children who may get harmful effects from the virus. Obviously, it's an ongoing process, because again, the committee keeps reviewing all the data from around the world, and depending on what the new data comes out from the rest of the world, we'll be making more decisions. But at the moment,
Doctor, there's also this study that's come from the UK about children and young people with long COVID, and that has talked about how 1 in 7 were found to have long COVID condition symptoms that went on for more than 3 months. So even that is a worry that even as we say that children between 12 to 15 are not so badly affected, they don't see severe disease, but no parent wants to risk a child getting long COVID either, or is that what is your view on that?
Yeah, absolutely, you're right. I mean, there has to be a risk-benefit analysis, as I said. The report about the long COVID was mainly in people who were immunocompromised, and that is why the committee now suggests that people who are immunocompromised should definitely be offered vaccine, and that is what the UK is doing. So children between 12 and 15 who are immunocompromised are being vaccinated in the UK left, right and center. So again, I think it is an ongoing research, it's an ongoing thing that we have to keep an eye on, obviously depending on what the data is available from the rest of the world, because there have been very bad cases of myocarditis in very fit children in the US, and we don't want any of those to happen in the UK.
And this is the Pfizer vaccine particularly, if you could just tell us, because here in India we are waiting for when the children will start getting vaccinated, the schools are opening, so there are lots of concerns around this issue.
Correct, it was mainly from the Pfizer vaccine, as you know, because again US they were using most of the Pfizer vaccines. But as I said, that AstraZeneca and Pfizer, the expert groups are still doing some more research into this, into younger children, to see if this is safe to give, and some small research is already happening in younger groups and younger children to make sure that they don't get any major problems and complications from the vaccine.
All right. Well, thank you so much, Dr. Rajay Narain, for joining us on this very important issue, and we'll be in touch as more data is available and we get that final decision of the government there. Thank you.
Thanks.
Well, with that, time for us to slip into a short break. Coming up on the